Okay, if I can ask everyone to please take their seats. We're going to get started. We have over 600 people between here in Vancouver, Okanagan, and online, so this is really very exciting. Thank you. All right, so I'm going to get started because we're in a bit of a tight timeline here. The purpose of this panel is to set the context for exploring digital resilience and youth mental health through interdisciplinary collaboration and innovation, and to emphasize the role of research action partnerships in addressing complex health challenges related to the effects of social media, both in terms of challenges as well as opportunities. We have invited several panelists who will provide their unique expertise and perspectives on the impacts of social media on mental health. We also want to hear from all of you, and I encourage you to participate through Slido and engage with the discussions. I would like to start the session by introducing President Bacon, who has very kindly agreed to provide some introductory remarks to set the stage for the symposium. Dr. Bacon is the 17th President and Vice Chancellor of the University of British Columbia. Prior to coming to UBC, he was the President and Vice Chancellor of Carleton University in Ottawa. I first met Dr. Bacon early this year when I was invited to join a panel discussion on generative AI in teaching and learning. Dr. Bacon hosted a very lively panel discussion, and it was then that I learned that we had a common interest in the brain. Dr. Bacon has a PhD in neuropsychology from the University of Montreal, and his research interests are in understanding the neurophysiological and cognitive basis of visual and multisensory perception. The reason I asked Dr. Bacon to join this morning is that he is a passionate champion for mental health. He is very open about sharing his own story about depression and substance use to inspire others and lead the university community in a collective effort to overcome the stigma around mental illness. Please join me in welcoming Dr. Bacon.
Well, thank you very much. Hello, everyone. Bonjour tout le monde. Everyone online, too, thank you for joining us. It's a real pleasure to be here and to have a chance to explore with you together how we can better support youth mental health in a rapidly changing and increasingly scary world. So thank you so much, Dr. Virgie Baboul, for the kind invitation to be here today. I appreciate it very much. Dr. Sky Barbic, thank you so much for moderating the panel today, and thank you to our panelists as well for sharing your voices and expertise. So when people invite me to speak on mental health and substance use, I try to say yes. I don't think there's anything more important today. We're in a crisis and we need to do better. So the conversation that we're having today is particularly important. I don't need to tell you, millions of young people are growing up in this world that is hyper-connected on the one hand, but also emotionally isolating. And there's no question in my mind, and maybe that will be discussed on the panel, that the youth mental health challenges that we're seeing and the exposure to new technologies, notably cell phones and social media, are intrinsically linked. Mental health is an institutional priority for UBC, and for me it's also personal. I struggled for a long time with a form of PTSD, with depression, and then of course with substance use, which was an attempt to feel better. An attempt that in the long run doesn't work. Healing's always possible. I like to remind everyone of this, but it's never linear. There's ups and downs, and it can't happen alone. It requires help and support. So UBC recognizes that mental health and well-being is a challenge for our students, faculty, and staff. We also know that it's integral to our academic mission and our collective success, so we attend to it. We do try to help. We're embedding health and well-being into the very fabric of our campus through our strategic plan, which is currently being refreshed. We want to do more. We have a wellness framework in full implementation, a student strategic plan that does focus on health and well-being, and we've also, of course, adopted the Okanagan Charter for Health-Promoting Universities, which was designed right here at UBC on our beautiful Okanagan campus. So we know that everyone experiences mental health differently, and that's why we offer a very broad range of services. There's no one-size-fits-all. We've embedded counselors in faculties for easy access. We have counselors in residences as well. We have peer-led support programs, Indigenous wellness models, 24/7 virtual counseling as well, which is very, very popular. It's so important to address mental health issues on the whole spectrum, not just when individuals are in crisis. I'm very excited that soon we'll be opening a flagship building on campus, the Gateway Health Building, which will provide a one-stop shop for all health and mental health services on the mental health campus. It will be transformative. You can't miss it. It's a beautiful building right by the big UBC letters near the bus loop. We're also soon to open the Recreation North Center, which will triple our indoor recreation space for athletics and recreations for our students, faculty, and staff, because physical health and mental health are one and the same. We're confronting the broader determinants of well-being, like affordability and access. We're investing in housing, which is so important, food security, childcare, and emergency support, because we understand that mental health is shaped by every aspect of student life. Briefly on the digital landscape, I'm no expert, but there's no question in my mind that social media can be and often is a source of harm. I do understand that it can also be, if used intelligently, a platform for healing, for connection, and for community. So the question really is, how can we move from all the risks and negative impacts of these digital platforms to using them for good and to resilience? How can we equip our young people to navigate these spaces with strength, with self-awareness, and with hope? I don't think there's anything more important, because the young people of today are the leaders and the workforce of tomorrow. We need to do better. That's why today's conversation matters so much. We have to believe collectively that we can build a future where digital tools are allies, because they're not going away. These are our two options. We can continue to put our young people at risk, or we can find a way to turn the tide and make these digital tools our allies in mental health. How? Tricky question. So I look forward to the panel. Thank you, everybody, for being here. Thank you for the work that you do every day, for your partnership with UBC. Merci beaucoup. Thank you very much, and enjoy this event. Thank you.
All right, I'd like to now introduce the moderator of this event, Dr. Skye Barbic. Skye is a registered occupational therapist with a clinical subspecialist interest in the rehabilitation of adults with serious mental illness. She's an associate professor in the Department of Occupational Science and Occupational Therapy at UBC and the director of research at Foundry. She also holds a Canada Research Chair in Integrated Youth Services in recognition of her immense contributions to the fields of youth mental health and health outcomes. She and her team have made significant advances to improve health equity and health outcomes for youth in Canada. I'm going to now hand it over to Skye Barbic. Thank you, Skye.
Good morning. So my name is Skye Barbic. I use she, her pronouns. I have the pleasure today of talking about the thing I love to talk about most, except for my kids and baseball. But I just want to put a plug out for the UBC baseball team. They're doing amazing. So if you want to watch the best baseball, go see. They're in the finals today. But youth mental health is really a critical topic. And we have an incredible panel of folks together to talk about it. When Naz showed me the panel, I thought we were in the wrong place at the wrong time, because you'll see it's a very diverse panel, and not the typical people you'd think would be talking about this. And so it's a good thing, because we've been talking about this topic of digital resilience in young people for a long time, and we haven't really come up with a solution. So it's going to be really interesting to hear diverse perspectives. I'm going to introduce our panelists shortly. We have two folks online, and Eva, today I'll sit beside you so you don't feel lonely on the stage, I promise. But I've only given them one rule today on the panel. And this rule is based on about a decade's worth of experience of our colleague Al Raimondo and I doing a lot of these types of panels in e-mental health. And unfortunately, Al can't be here today, was not able to be joining us today. But if Al was here, the rule is that this is not a black and white topic. This is not digital resilience is bad, digital resilience is good. And what has happened for decades is we have gone to these conferences, and I'm not joking, there is one side yelling at the other side, and there's no middle space. And so we're talking about this concept or this construct of digital resilience as a continuum, and how do we support young people to thrive in their environments in this real digital environment. So our panelists, I'll start with Eva, who's in the room. Dr. Eva Orle, who's an associate professor as part of the Human Early Learning Partnership Program in the School of Population and Public Health here at UBC. There's your phone number, too. I won't read that out to people. Thank you for that prompt. And then online, do we have our fine folks online? There they are. Okay, and so I'll introduce Dr. Sarah Gregory, who's the farthest away. Dr. Sarah Gregory is a research fellow from the Edinburgh Dementia Prevention Program at the University of Edinburgh. And we also have Dr. Alicia Cummins, who's an instructor at the College of Humanities, Department of Sociology and Anthropology at Carleton University. And so this is our team of panelists today. Sound good? So we all remember the rule? No black or white. And we have a series of questions that we're going to work through. I'll ask the first question, and then I'll move my way towards Eva so we look like we're not lonely on the stage. But our series of questions moves through some themes about understanding what digital resilience looks like, understanding what the role of digital technology should be post-secondary education, talking about the transition of post-secondary education and the role of these new students who've gone through the COVID era. These are the students who know technology better than anybody, who learn, who access health information, every piece of information through technology. This is the group that's now transitioning into post-secondary education. We'll talk about that. We'll talk about policy, we'll talk about equity, and hopefully we get to the future landscape. Okay, sound good? So my first question is to all the panelists, and Eva, we'll start with you in the room, and then we will go to Sarah and then Alicia. The first question that I have is, what is digital resilience in today's context of youth?
Okay, yeah, can everyone hear me? Thank you, Sky. That's a really good question, really big question to start out with. And I just want to start up front by saying that I have lots of thoughts and feelings about this topic from the perspective of a researcher and then from the perspective of an adult who uses devices all the time myself, and of course also from the perspective of a parent who's managing young children, youth in the way they manage screen time and social media in particular. And I think when we think about digital resilience, one thing we really have to keep in mind is that screens, like social media, like phones, all of these digital devices are a part of our life, and they're a part of young people and youth's life. So we need to find ways to teach them how to responsibly manage their screen and online behaviors and interactions online, and really helping them navigate this world rather than thinking about this from a perspective of saying, like, no access at all, because we actually do know from data that those who are not having any access to social media or the online world are actually not doing best. Like that's not the group. That's not what we're aiming for. So it's really more like this, almost like this constant risk management, which is harder because there's no clear line, and it kind of depends on the individual, and really like building resilience by providing young people with the skills and also the support and protective factors to manage this world. I think you have to switch it on here.
This is the best tech team in the world. I've worked with them in the past. I know you don't have to do anything. You just stand here. It happens magically. Sarah, how about you? What are your thoughts?
Thanks, guys. Great to be here. So yeah, from the lens that I'm bringing to this from dementia prevention, myself and my colleagues are starting to look at what is important for us to understand from a brain health dementia risk perspective in people who are 18 to 39, where we really don't know a lot. We know quite a lot now about modifiable risk factors for dementia in people aged 40 and above, a little bit about younger adults and children in terms of education, but this is kind of the unknown group. So this is a really interesting topic. And we've done, the work I'm involved in is very much in kind of a design phase. So we've done patient public involvement, focus group survey. So I probably bring a lot more questions than answers necessarily today. But one of the outcomes from one of our focus groups was a really nice visualization. And around the digital technologies, it was find a balance. It was the young adults understanding, how do I find that balance to support my brain health throughout my life and minimize my risks for developing dementia as I age, use digital tools to be beneficial to me, to build that online community, to get access to education, to use it as ways of working and things like that, but also to manage the risks and make sure that it's not something that is becoming harmful to our brain health. And this is a age group that is so unique in terms of dementia risk. This is not something that we have evidence on, because the adults we're working with currently who are presenting with diseases that cause dementia have not grown up with these tools at all. So this is such an important question to start asking within this group. So we've been thinking about digital resilience in terms of understanding, is there a balance that we can identify that maximizes the positives of brain health and minimizes the harms, and what might those benefits and harms look like?
Alicia, I wonder if you can go into it and also talk about your research, and I'll roll right into that second question as well, since you're next, about what is the role of identity in supporting youth in this space?
Thanks, everyone, and thanks for inviting me to be here. So just so that everyone knows, I'm a religious studies scholar. I study religion from an anthropological and sociological perspective, but my focus over the recent years has been identity construction, and particularly religious identity construction and what makes resilient identities. So I'm approaching this very much from an identity perspective when I look at what is digital resilience. And I had to sit with this question for a while, because I'm thinking, like, what is identity resilience? And my research really looks at like this, resilience starts within the family. Right? It starts during childhood and it goes into adolescence, into emerging adulthood, where you want to make sure that you set your children up for success. You role model healthy digital behaviors, right? It's not that you don't use digital media or you don't engage in digital spaces, but you think about, what is the intention? Why am I engaging in these digital spaces? How am I engaging in these digital spaces? Do these spaces align with my beliefs and my values? Right? And then through that, you find that, around the age of maybe later adolescence, but more likely emerging adulthood. So when people are entering university, they are naturally self-protecting. They have their own self-protective behaviors, right? They're already thinking about like the spaces that they engage with and whether they align with their values. So that's kind of where I come from in terms of identity, and what does that look like when we think of digital resilience?
Thank you. So I'm going to turn it to you. It's a big question. You can answer it as a mom or as a researcher. If you're bridging any research into action, you have to wear, sometimes I say just wear the researcher hat, but you can't. You have to wear all the hats. So what are the most pressing digital threats that face young people today? Things like misinformation, cyberbullying. Can you talk about that?
I mean, you already mentioned two of them. I think these are really definitely two big threats: misinformation, and also part of misinformation is also that the way the algorithms work with social media is that it's quite easy for people to get radicalized, like to be fed like stories and links and so on into the direction that you're kind of looking for. So I find it really divides society, and it creates a divide. And you can think about this politically, but also regarding other values that individuals have. So I think that's one big threat and risk. cyberbullying for sure, for young people to put themselves out there with pictures on the various social media apps, and there has been a lot of abuse and bullying and targeting, and with some of them just mental health wise with very unfortunate and negative outcomes. So I think that's definitely a second thing. I also don't want to speak about something else though, which is the risk of what are you displacing by being online all the time. And this is really also something I feel comfortable talking about because it's my research in particular, where we've done lots of research showing that youth who are spending very long hours in the online environment, they also tend to not participate in extracurricular activities and have much less in-person time with their friends. And I think this is really a serious risk because when you are spending time in person with friends, that's when you're really building close, intimate relationships where you can really trust each other. You're building really important social skills that are important for life. If you think about extracurriculars, pursuing meaningful activities that take place in person, this could be physical activity. We do know that the screen time displaces physically active time. It's very clearly related. That's why we have the 24-hour guidelines also that are all interrelated to look at our children meeting or youth meeting the recommended amount of time for physical activity and screen time and sleep, because they're all three interrelated. So just thinking about this from a perspective of what are you not doing when you're online too much, too often, I think this is something for us to think about. And then when you're online, what are you actually engaging in? And that goes more into the less of the time spent online, but more of the type of content individuals are engaging with. And what does that do to your own feelings about yourself? And what are the pictures you're looking at, the messages, and so on?
So it's an interesting thing because we sort of started of defining youth about, when we're talking about young people in this panel, we're talking about 12 to 24, and we're trying to focus on this group of young people transitioning to post-secondary education. And Sarah, I'm going to flip this to you right now. One of the things we hear a lot of our parents saying, the kids today aren't the same as the kids when we were kids, or even kids 10 years ago. So what do we know about the developmental stages of young people today, and how that supports their ability to build digital resilience in this new tech world?
Yeah, it's a great question, and the 12 to 18 is definitely not my area of expertise, and I'd be really interested to know kind of others' views on this. In terms of the 18 to 25-year-olds, we know that there's still so much brain development that's happening during that period of time, and in that post-secondary world where you're out trying to navigate without a lot of the maybe safety nets placed around you, your brain is still developing some of the more complex aspects, and being able to manage all of this whilst building digital resilience then becomes really important. And for the work that we're doing, we're considering 18 to 39-year-olds. The 18 to 25 group is going to be potentially very different to the 26 to 39 group, or even, the 30 to 39-year-olds. So making sure that we're understanding, well, how does that developmental stage play into benefits and risks? And tying it back to dementia again, this is why it's such an important age for us to look at to understand about brain health, because currently, if we pick up social isolation as an example, we know that's a big risk factor for developing dementia. But currently, we only really focus on it if you're socially isolated later in life. But what's happening if you've got an interaction between the developmental stage of 18 to 25, digital resilience, and you're not developing that in a healthy way maybe, and it's setting you up for a life of social isolation potentially? What's that going to do to your brain health longer term? So I think understanding this through kind of the lens of the brain's development stage alongside how we best educate, skill our young adults to be able to use these digital tools is definitely going to be really important for research and for policy and for how institutions can help to support young adults navigate all of this.
So let's talk about the institutions that come before post-secondary. And so Eva, just a question for you about how are we preparing, or how are primary and secondary, I'm going to use primary because I know that technology is in the primary schools as well. How are primary and secondary schools or institutions preparing students to transition into post-secondary in terms of digital resilience?
That's, a really good question about how are we preparing young people, because right now, I mean, as of last year, there is I think it was big in the news also, that a ban of recreational screens in schools. However, now that there have been a few months now of this being implemented, and it looks a little bit different from school to school and school district to school district and system to system. It seems like, in elementary school, it's a bit easier in the sense that elementary schools are smaller and not as many students have phones yet, and you have supervision aids and so on. So it's just a bit more contained, and it has been quite strict there in terms of like no screens on school grounds, not during lunch break, not during recess, only, and for that, I think just iPads come out that are sometimes provided by schools, like for educational purposes. Then once you see children transitioning into the high schools, however, in high school there is this self-management kind of expected. Like kids have their phones, you use them for educational purposes, not supposed to use them for recreational purposes, but no one really monitors, and it's kind of like a self-monitored practice in many schools for now. So I already kind of feel like there's a bit like, okay, well, where do they learn this? Where do kids learn this when they step from elementary to secondary school? And I think this is just something that still needs to be addressed a bit better. And then, of course, the transition into university is like even bigger in the sense that all of a sudden you're an adult. And now you need to know how to manage this. And I think especially students who are coming out to campus and live on their own for the first year of their university undergrad time, it's a really big transition. And the things young students are learning, young adults are learning during that year in particular, or during those first couple of years, are, I would say, these skills and the non-academic skills are the biggest things to learn. The course content and the academics, it's almost secondary, I think, when it comes for life lessons to learn.
So I'll put that to you, Alicia. Should post-secondary, should this be a core competency, learning about digital resilience and learning how to be digitally resilient? Is that the verb? But yeah, so should this be the first 101 class you take when you come to UBC?
I mean, I don't really know how to answer that question, because I really feel strongly that this intervention needs to start so much sooner than university, because there's all these other things happening in university. So yes, I do think that there should be opportunities at university to build media literacy, build critical thinking, understand mental health and identity, and understand mental health and identity, and how our digital world can affect these things. But I kind of think that by the time you get to university, if you don't have that solid foundation built during mainly adolescence, like during that really important key developmental phase, you're not going to be navigating the digital world as effectively as you could, right? So again, like navigating those worlds with intention, and really thinking, like, does this align with my values, who I am or who I want to be, right? And again, doing this kind of or doing these kinds of practices, you're setting that that individual up to navigate that world on their own, to create their own boundaries for engagement.
I'm the mom of a 17-year-old daughter going into post-secondary next year, far, far away. And so I'm increasingly anxious as you're talking about this. Did we do enough? And maybe she shouldn't work this summer. We just have to send her to you to be coached for the summer. But it is a bit of a fearful world. But I'm also an educator, and everything we rely on for teaching is technology. So it's a balancing of all these worlds. And I'm just curious for all of you, and Sarah and Alicia, especially coming from different institutions, what are institutional practices or policies that could enhance digital resilience on campus? Like, what are things that are out there right now that could support young people to be digitally resilient? Sarah, you want to start? We'll go farthest to closest this time. How about that?
Yeah, so I think we've got some really nice examples from the University of Edinburgh. We've got kind of digital safety supporter toolkits, so people who are involved in student well-being, or if we've got student peer mentors. There's kind of toolkits around various points that you can use to help have meaningful conversations and signpost people to different places. We've also got a really active and engaged chaplaincy who do some really nice events. There was one that I was looking at a couple of days ago that was mindfulness about the amount of Zoom calls we all do. And there was just, a little 5-minute meditative breathing exercise, and it really helped my day. I thought that was brilliant. So to have kind of tools like that around the wellness, I think is really helpful. We've also got lots of kind of guidance on how you use generative AI in your academic work to help students navigate what can they and can't they use these digital tools for, and still maintain academic integrity. I think one of the challenges is definitely keeping the staff base up to date with these really fast moving pieces, and how do we keep our policies aligned to the next technology that comes out. I know that I teach kind of masters and undergraduate level, and my students know a lot more sometimes about these emerging tools than I do, and so you're always kind of racing to catch up. So I think that that's a real challenge for our institutions, is finding ways that we can keep our staff at the forefront of this as well, so that we can best support our students as they're coming through.
Thanks, Alicia.
Yeah, there's all these opportunities for, integrating into like orientation programs, for first year students, like first year seminars. I came across actually just today in my email that there's going to be an event happening, and I do bonus activities for my students where they can go to an online or in-person event on campus and earn bonus points towards their grade in my classes. So like one of the things that I'm going to do is I'm going to say, hey, if you want, you can go to this seminar on digital resilience, and that's exactly what it was called, similar to what we're doing today, and earn up to 3% as a bonus activity, after reflecting, writing a short reflection paper. Other things that we can do is we can um, promote research in this area, right? Like we can try to do everything that we want to do in in early interventions and understanding media literacy, digital literacy, how this affects your mental health and well-being. But unless those digital environments are safe and secure themselves, right? Like we've got some really unhealthy algorithms out there that are just there to basically keep you engaged, keep you stuck on, Instagram or Facebook or Twitter. And so maybe like thinking about, putting money towards research in like ethical algorithms, peer-reviewed ethical algorithms, right? So that we can do the work and teach students about the importance of digital literacy, but then they're also able to engage without being bombarded with images that they didn't set themselves up to view. Yeah.
That's such a great idea. I'm going to steal that 3% idea for sure. And you make me think a lot about, I think if Al was here in the room today, they'd say you would co-design those algorithms with young people and like have young people at the table consistently shaping, because you're right, they do know sometimes before what the technology is, and certainly during the pandemic, we at Foundry discovered that a lot of new young people are coming in with worries about ADHD, and like, why do you have ADHD? Why are you coming in now? And they said, well, I saw it on TikTok, and that person looks exactly like me and is experiencing all that. And then we went to go look at how often TikTok was being used to navigate mental health services or mental health information. And per person on the planet, there were 8 hits per person on the planet of looking up the hashtag mental health. So we're talking in the order of 70 billion people, or 70 billion hits on just the hashtag mental health. And as researchers, we're trying to be like, please read my paper, it's the best practice. And so I think there's this bridge of realizing where are young people actually getting their information, and how do we actually feed the algorithm with the best information possible. Anything locally at UBC you want to talk about for policy and government? Do you want to go down that path bravely?
I think one last thing I'd like to mention is, yes to all the toolkits and so on and the information. I think we have to think about, okay, there's the information, and then does the information translate into behavior? So I think that's kind of something for us to think about as researchers. How do we also bridge this, and what do young people need to translate it into behavior? And I kind of want to tie it back also to the beginning of how you opened, which was the baseball. And I'm not a baseball mom, but I think these are activities that are opportunities for young people on campus to get together in person, not just for the players, but also for those who cheer for the players, for the community, for everyone. So, and I'm mentioning this, that in addition to providing the support and the knowledge around digital resilience, providing opportunities for the community to really get together in person will really form strong social supportive networks that are, concrete, in person. They're hugs, there's just a lot more going on, and that also, I think, is important for having digital resilience.
Great. So this is also for all of you right now, but how do we create the safest ecosystem in our university structures for folks to ensure that they have digital, I don't want to use the word digital resilience in this category, but that we ensure that they are safe, that they can come to university and learn, they can be in learning environments where they're developing in a four-year undergrad program and they're not worried about their safety and structures. And specifically, what's the role of the government here as well in supporting post-secondary institutions to enable our students to be safe and to thrive and have good mental health? Shall we go to you, Alicia, this time first?
I mean, as soon as, the question is really important, but it immediately makes me think, are we censoring information? And then are we really a free society where we have free information? So there has to be a balance. And that's why I think that, kind of instilling healthy engagement in digital spaces is probably more important than limiting it. I mean, students and individuals can limit it for themselves. And again, I'm thinking of Blue Sky, for example. So I just recently joined Blue Sky with the exodus of Twitter. And what I've noticed is that you can actually change your algorithm by you can subscribe to certain different kinds of algorithms that are going to bring in different content that you actually want to see. You want to see more things about cats. You add that to your, this is what I want in my newsfeed, right? Or health and wellness, etc. And so I feel I'm nervous to limit content. I would rather instill the behaviors and practices to help people navigate that content and choose and be able to decide, what shows up on their feeds.
So I'm really interested because HELP has a very strong, the Human Early Learning Partnership Program at SPPH. They have a very strong relationship with government, and one of the things I'm increasingly feeling is how, in terms of the theme of the conference, bridging research to action, what is the scaffolding that we need to have in place that our research is getting to government quickly, or that we're listing, or maybe not just our research, maybe the voices of young people are getting to government quickly? How do we enable that to happen?
And really good question. I think one of the things is just having the partnerships and having true partnerships where there's really a connection between government and researchers. Having tables we sit on together where we actually get to join together and talk, and making sure those are evidence and data informed. So, as you said, the Human Early Learning Partnership, we have a monitoring system where we collect lots of data, population-based, every year, and these data, we make them readily available by sharing them through interactive data dashboards. So that means that knowledge users can actually use the data, and they can look at the data for example, screen time, in their neighborhood, or in a school district, or in a larger health authority region across the province. So that way, having these ways of sharing data quickly, interactively, in a way that we've heard from knowledge users, including government, is useful to them. So that engagement, that partnership to learn what do you actually need to make your decisions and how can we provide it. And also tying it back to the youth though and saying, what is it that the youth want to talk about? What is it that the youth want to share with government? Because I think that's one of the first places also we need to then come back to. And for example, what we heard from youth is partly, and this is, you know, like a larger project that some of my colleagues are working on and I'm involved in, is youth want to talk about climate change. They want to talk about eco-anxiety. And some of that actually ties in with the digital world, because a lot of this is shared online, and some of the anxiety is also happening because youth are engaging a lot in these topics online. So just like really bringing all of these together, the youth, the government, and the data, and getting this out there, and yeah.
It's really interesting because I'm hearing you say that, because a lot of our colleagues work together on the COVID recommendations for young people during COVID, and youth really said that they felt villainized during the COVID pandemic. They were the bad people, and then all of a sudden they're important and they're being asked to step to the table and they're like, no, thank you, I don't want to be there. Like, no kidding, they don't want to be there. And so building that trust in that environment for young people to come co-design these solutions with government and post-secondary institutions is really quite critical. And I think it's building that trust again, though, is something. Again, if Al was here, would say it's going to take some trust building, because COVID and government and young people didn't quite go together during the pandemic, because they really did feel villainized, and that was a tough experience. So a lot of our engagement right now has been about building that trust. Alicia, I'm going to head to you and ask you this question. How does digital access and the quality of digital engagement shape identity development and resilience among equity-deserving groups?
Yeah, so I feel like access doesn't necessarily equal equity, and access alone isn't enough. It's the quality and intentionality of engagement with digital spaces that really shapes identity and resilience, in my opinion. Marginalized youth, especially those navigating like complex identities, such as, you know, their a marginalized religious or racial identity, gendered or sexual identity, even and any sort of immigrant identities. Sometimes digital spaces can affirm healthy identities, and sometimes they can fracture the sense of self, right? And again, like this thinking of like where they're going for information, and how unhealthy some of the content can be in terms of their own identity reflection, and whether it makes them feel less than or not enough because of the images or the content that they're encountering. So when youth encounter affirming narratives or online or communities online, they can build stronger, more resilient identities. But when these spaces are hostile or overly algorithmic, youth may internalize these harmful messages. So that's why I would say that we need support, not just digital access, but critical engagement with the content and identity affirming digital environments, right? And again, not all communities really have access to this in their physical environments. And so sometimes digital environments provide these communities they wouldn't otherwise not have access to.
That's great. Hey, Sarah, can you see the questions on Slido that are on our screen? I want to know what you can see on your end.
Yes,
You
yeah,
can
we
see
can
them?
see those.
Is there one that excites you? Because the writing's so small that I can barely read it. So either I'm going to awkwardly get up and look, or tell me what you see that excites you on that list. Yes, thank you.
So this one here, which was for Alicia, around peer-reviewed ethical algorithms, how can we invite youth into the conversation and development of better algorithms? I guess building on the, how do you kind of bring young adults and adolescents into the co-design process when you're building on kind of things like the pandemic where they may have felt excluded and things like that.
Could we pin the page again with the questions?
Oh, great, because I was like,
one.
I can't see these, and then I opened Slido, and I'm like, I don't know where to go. So.
Okay, I'll read it. It's the fourth one, right? So such an interesting point of peer-reviewed ethical algorithms. The question, Alicia, is how do we invite youth into the conversation and development of better algorithms? And while you sit with the question, I'm going to fully confess that my son had a science test today. And I knew about this 2 weeks ago, and so I filled his Instagram up with mitosis. I just stole his Instagram, and I just like started looking up things on mitosis and plant cell biology. And he's like, "Mom, I'm getting a lot of baseball and cell biology on my Instagram. They must have heard us studying." And I was like, "Oh yeah." So I still have his password to his Instagram, which is easy. So I got to fully confess that I co-designed his algorithm. I'll let you know
I
if
love
it worked
that.
or not. But
I
yeah.
love that. Well, I feel like this, there's two ways immediately come to mind. And one is to to decide to use platforms that allow you to choose your own algorithm, to cater an algorithm to with the content that you want to see and the content that you don't want to see. So very easily, anyone should be able to do this. And again, Blue Sky has it set up. This is very easy to do. I want to see cats. I want to see things about the environment. I want healthy vegan recipes. I want whatever, right? Like it helps, like it gives the users the power to choose the content that they see in their newsfeed. Another way is honestly funding research in universities and getting student researchers to really play an important role in this. They've gone through it, especially like you said, the COVID generation are now in university. And so they already know very much like how technology can be something, a source of, like very good engagement, but then it can also have like detrimental effects on your health, right? And forms of isolation. So again, like I think that if we're thinking about like just really easy ways, is having platforms that allow you to decide for yourself what algorithm you want, and then and funding research with student researchers involved in the process.
Great answer. Can we see the Slido questions big again? Thanks so much. Eva, anything that excites you about that board you want to address? That last one looks like it's for you.
Should parents' advocacy groups push social media companies to place more regulations online on online youth activities? For example, yeah, I mean, I think advocacy is really powerful, and I think I'm just wondering how easy is it for parents to get together and organize themselves to do this advocacy? Not all parents have that opportunity, or have even thinking about barriers, language barriers, other barriers to really do advocacy and speak up. But I think what we can really think about is who are those advocating for youth, and those can be adults other than parents. Those can be teachers, educators, community leaders of community organizations. So anyone who is an advocate for youth, I think, should be stepping up and thinking about how do we improve the safety of the online environments. And yes, I think kind of thinking about the competing interests. I mean, social media, like organizations and companies, they have their own interests, and their main interest may not be necessarily the safety of youth. So just making sure that the interests of youth, that what is in the interest of supporting their mental health is in place, and advocating for that is important, yeah.
You guys have anything to add to that? No, we're good. Okay, we can't talk about this topic without AI, and it came on, I think it's the first question that's there. So I'm curious, Sarah and Alicia, either of you, about what's your perspective when digital resources overlap with AI, and how do we implement these tools, but also setting potential boundaries. And I was really grateful to hear our president outline all of these resources at UBC, but also how they're fitting together and how they're integrating. And this is something we're increasingly seeing at Foundry is folks who have gotten their information through AI, or there's AI counselors now that exist. And there's a lot of tension, like in this world, about the role of AI in not just feeding what's coming into the digital media resources that people are looking up, but also now providing care, potentially being clinicians, or providing access to tools and resources. So would love all of your thoughts on that. And Sarah, we'll start with you.
Yeah, it's such an interesting question. I'd been thinking before the panel about kind of AI alongside this, and just kind of what a fast-paced and increasingly fast-paced environment is putting us into in terms of how things are changing. And I think what of the opportunities we have, picking up on everyone's kind of discussions around co-design, is our young adults are the perfect people to help us co-design the solutions to the problems these are going to start to bring, because they are going to have some of the best knowledge of how to use these tools, where they're using them, what's useful about them, but what they find really challenging as well. So making sure they're involved in the conversations. But also maybe finding really good opportunities for kind of intergenerational work on this, where young adults who potentially have grown up with a lot of these tools are maybe kind of digital natives, can adapt really quickly to this changing environment, could actually do some really brilliant work with other generations who find this a lot more challenging and are going to be very challenged maybe in a job market or in kind of social engagements where they're suddenly very out of their depth. So I think that there's definitely kind of lots of obvious risks that we could talk about, but I think that there is potential for benefits around here as well to develop some really nice kind of co-design, code-led work with young adults and develop intergenerational opportunities as well.
I really like that. On our panel before, Dr. Gabrielle Legault and I have worked on some projects, and we were working about like understanding what youth engagement looks like in Indigenous communities. And I thought, well, just invite all the youth. They're like, no, absolutely not, invite all. And we had much more intergenerational perspective, and it was so fascinating. And it was the first time I've ever done that or learned from that community and learned from Dr. Legault and their team about the importance of having multiple generations at the table, even if you're talking about young people. So it's a really neat perspective to hear you say, Sarah. Alicia, any thoughts on that?
I think I would just say, it's just the same thing when we think about like mindful social media platforms to engage with and those that may not be certainly healthy just because of the way that the algorithms are. The same goes for AI in that, you want to engage with those AI models that are like that basically fact check themselves, that are pulling information from important resources, but also have disclaimers, right? Like just like this is what research says, but consult your medical care provider before making any life decisions or overdosing on supplements, right? Like people don't realize everyone's taking supplements these days, and it's like you need to make sure that you're taking these in like in with care with your naturopath or your medical doctor, right? So I think that, having youth engage in developing better AI models to make sure that there are disclaimers about and the limits and being models being more transparent about what they can and can't do, because we don't see that. We don't, like, at least the ones that I've been trying to engage with and trying to learn from. There's still so many limitations. And I think that, the AI models want to present themselves as having everything, as being the one-stop shop for information, and it's just and it can be like we discussed, like it can be harmful.
They don't give hugs, Eva would say, right?
I say, I'm just so old-fashioned. I'm realizing here. I mean, there's absolutely no place for AI, and I think, and I kind of heard that also a little bit from you, is that for me, the place of AI is really to provide the information. I think for me, when we move over to care is so human, so it's really hard for me to see the care part completely delegated to AI, to be honest. But definitely, that place for there is an important role of AI in this place and space, which I see and I recognize, but thinking also about those who design those tools, who kind of make sure that the algorithms and the way it runs, how it performs, that it's culturally sensitive, and that this is something that ultimately supports the health and well-being of youth. So that really is a responsibility on the shoulders of those who are designing and monitoring those tools, and it's really beyond my capacity to understand how that works and how we can make that safe. But to me, it's like it needs to be done right at the outcome level. How they do it, I don't know, and they got to figure it out. And I still want to reserve the care for human interaction and hugs.
I think it's so fascinating because one of my biggest issues with healthcare systems and healthcare development is the definition of health that we have, and we still use this World Health Organization definition, which means to be healthy. it's the complete absence of disease and infirmity. I might not get that perfect, but the complete is the important word there. And if you use that definition, nobody's healthy, like at all. And so you're dead or alive, or you're healthy or you're not healthy. And that's not how we are. That's not how we operate as humans. So the interesting thing that our president outlined was like a bunch of services. And that tends to be what we do when we're in crisis. Let's keep building a bunch of hospitals at the bottom of the cliff, and hopefully we'll get away from the crisis. How is AI, or like what is the opportunity for digital technologies to support young people, not just connecting to the services, but connecting across the health continuum of these services? Like maybe I'm doing great and I'm first day university, I just want to know about health promotion or health prevention, or I want to be, what did he say, the physical at the baseball field or whatever he was saying. But what is it? How do I get to that like first level of care if I need to just go have a basic counseling service? And what do I do if I'm in crisis? We tend to have like all these things, but they're not connected. And so what is the potential for digital technologies to help young people post-secondary to connect? And maybe we'll start here.
Yeah, no, I think that's a good point. Like bringing in that role there of building, building that connection and that network. Yeah.
Any thoughts online?
I agree. Just the signposting. It's just the information's out there, but making sure that the people who need it actually have it, and freeing up the humans to do the human care part of it. But the signposting could very easily be done by AI.
And we have some solutions online, but I'm going to ask you guys to make them bigger, please, for me. So one of the questions that we've asked online is, what is one critical policy, research, or practice gap, or a cross-sector collaboration opportunity that must be addressed to better support youth mental health in the digital age? And so we have some options here, and I just want to open it up to the room as well. If you have a question and you want to raise your hand or jump in or comment, please just raise your hand. We have a couple more minutes. But some of the solutions that are coming up online in turn, and I'll ask the panelists to reflect on these solutions, are about understanding the causality and barriers that influence, can I have it big, please? I didn't bring my glasses. Understanding the causality and barriers to care that influence youth to access digital mental health resources. For example, the use of AI counselors among youth could be because of barriers accessing human counselors, which is not enough, I'm assuming, or there's a financial or lack of culturally sensitive versions of care, which is a really, really important thing to understand. I feel like we almost know the answer to that. The answer is like, yeah, there's a problem, there's a barrier. And I want to be careful about doing the research to understand that, but also to get something done about that. The other solution is dynamically embed education for youth and across the generational divide. We are all living or learning in silos. Mm-hmm. And then widen the eligibility based on age, 15 to 29 instead of 18 to 25. And I think this is an important thing when we defined youth at the beginning, that often our child and youth services are 12 to 18, and then when you turn 18, quite frankly, when you turn 16, they say you're going to be 17, so you're too close to an adult, we don't want to see you. And then when you're 18, or 17, you're too close to childhood, we don't want to see you. Being 17 in this province of BC is a really bad place to be, but it's also the age where we're seeing people come into the university post-secondary environment. So it's just a really, really interesting comment. So any thoughts on that, Eva, these comments?
Yeah, no, I mean, I really like the idea of widening the eligibility, because that kind of speaks again to this transition. We really need to understand youth as they're transitioning to be adults, which means we kind of need to capture some of these voices earlier. And, you know, I mean, 15 to 29, that might be a range. Or we could even widen it more, you know, just looking at the individual and the societal trajectories regarding these issues, rather than just kind of carving out a time frame or an age span that kind of meets a certain definition maybe, but doesn't really reflect the development of young people. So,
absolutely. Alicia, any thoughts?
You know, when that question came up, my immediate thought was, by the time we do this research and we do it well, it's going to be outdated because technology will have advanced so much, right? Like I'm just thinking about when we first got at-home computers, and when those computers became, basically handheld devices, right? And so I'm just thinking, like, how do we even keep up? how can, like how can we as researchers, as scholars, as advocates, how can we keep up? So I don't have an answer, but that's my immediate thought.
I remember 5 years ago having the smartphones and be like, okay, this is it, right? Like nothing's gonna get better than this. And then AI came. It was like, oh my God, what's coming after AI? And so you're right, like our research infrastructure is so archaic that we're working on projects that are, it takes 3 to 5 years to get something funded at CIHR. Or I'm not sure if this is better in the UK, but it's not so great here. Do we actually need like flexible research programming to keep up with like immediate action? We saw that during COVID. We saw really responsive research funding that was really responsive to elevating the voices of folks so that we could be part of research. They're really interesting.
And if I may add here, I think what we can do also regarding that is like what are the key ingredients we're looking at? And if the key ingredient is connection, then this can be connection in the presence of whatever tool. Again, the technology changes and all of this changes, and it may be in person or not in person. But I think just focusing on those like key principles that we're really interested in supporting and promoting and that contribute to well-being, then I think the larger context will be changing quickly because of technology changes, but we kind of focus on that aspect.
I love that idea, and I even love the idea of like, what are the principles at UBC? I need to go maybe do that and really anchor our work in principles and values that we have, and maybe it's time to update some of them, right? Maybe there's room to update them. Sarah, any thoughts on this?
Yeah, I really love the dynamic educational comment. I thought that was really interesting with the generational idea as well, because it ties into what we've just discussed around needing to have much more dynamic approaches to research and funding, but brings in the generational approach, which just, I think, gives us so many opportunities. If we are tackling problems across different generations, we're just bringing in so many different perspectives that you, on your own or with your peer group who are a similar age to you, are just never going to see. But also just brings in that human connection across the different generations that gives so much across so many different health conditions in terms of just getting out there and making new social connections and new friendships across generations. So yeah, I love that comment. I thought that was a really nice idea.
Really good idea. I'm just looking at the comments that are there as well about reflection prompts during and after scrolling. That would be really interesting.
And I guess it ties back into like, why am I looking? Why am I here? How did that make me feel? Right? Like, do I want to continue, looking at content like this? Does it align with my beliefs and values? So yeah, like I'm very much like thinking about like how we approach, right? And maybe it's all those social wellness books that I've read for my own well-being, right? Is that like, we need to be more intentional with how we spend our time and why we're spending our time in the places that we are.
Such a good comment. It's really interesting. And we're all sitting here feeling guilty because you probably were all scrolling before you went to bed last night on something. Like, why am I here? Because I'm bored or I just can't sleep.
Can I just add here that we just looked at MDI data yesterday, population-based data in BC with youth, where half of the youth reported that they are on their phones online just before going to sleep. Half of them, it's 50%. We knew it was going to be some, but we did not realize it was going to be 50%.
How many in this room were scrolling before you went to bed last night? Be honest. Yeah, we're about half of us. So we're as cool as the youth, is what you're saying? No, but it's a problem that I think, not a problem, I'm going to say it could be a good thing. It could be helpful to wind you down and just really understanding the mechanisms of that, but it's the access to it, and certainly for young people, it's something we need to explore immediately, not 3 years in a grant later on to figure out. But yeah, I think sometimes when we do talk about youth as adults and being really true good adult allies and researchers means you have to be honest as well about your own behaviors and what's going on. And sometimes I find myself studying stuff and be like, that's really bad. Young people shouldn't do that. And then I just do it all the time. And so that modeling and being honest with it and really realizing across the developmental continuum how important this is. All right, I have a couple of wrap-up questions for you about where we go next. And of course, I put the wrap-up question somewhere very fancy. There it is. Sarah, how you doing? It's late for you. You want to go first on these last questions? It's really about where do we go next, and what are your sort of concluding thoughts about next steps, and how do we bridge research into action in this space? And if you had like 2 really key things that you want to put forward as priorities, what would you say?
Yeah, in terms of next steps from the group that I'm working with, it's all about co-design for us. So working with our young adults to make sure the research questions that we ask continue to be relevant, and that when we're getting the data in, that we're analysing it and interpreting it in a way that makes sense to that age group as well. And I think that it's been so encouraging to hear co-design come up just consistently throughout this session as well. So for me, the next steps are definitely just continuing in the co-design direction, bringing this to kind of into the dementia research space as an emerging potential risk factor that we just need to start paying serious attention to, because by the time these young adults reach the risk age, it's going to be too late to start thinking about it. So really important to start doing that as soon as possible.
Alicia?
Yeah, going back to being intentional, like help students question their purpose for digital engagement, critical thinking, recognize biases, algorithmic influence, and misinformation, literacy, reflect on how content aligns with beliefs and values, understand how digital pressures shape, your image of self, healthy boundary setting, like if you've got studying for a test, right? It's like, you know that you've got to make sure you put time in to do that kind of thing. So, I mean, like, these are all tools. I know that implementing them, because we all crave that dopamine rush, right? We all claim that dopamine rush when we go online and we see a like, or we're engaging with content and finding other ways to kind of feel that, feel that rush. And then, of course, encourage open dialogue, normalize conversations around digital overwhelm, identity, and well-being. Like, let's keep having these kinds of conversations and making sure that youth are here to talk about their own personal experiences.
Yeah. I'll go back to the place of like schools, thinking like, how do we start early? How do we get it into a system that all young people, or most young people, will go through? And that way we can really reach young people at a population level. Thinking about this more from the perspective of how do we integrate this into school practices and pedagogy and curriculum, rather than like the one-off workshop here and there. I think at the moment we're still a bit more at the workshop stage, where a public health nurse might come in, give a talk like once a term or once a year, and that's it. And so just thinking about how can we maybe go one step further and do programs and interventions that really promote the healthy behavior to support mental health and well-being in young people, and then transitioning to post-secondary, where we can continue to do this.
All right, so I have about 4 minutes to wrap up, if I'm looking at you correctly. Okay, good. How have I done? First, before we wrap up, because I always forget this at the end, I just want to thank our tech team for making this possible today. Very grateful to you guys for making this run smoothly. And really grateful for Naz for inviting this topic to the table. It's a really important topic, and has brought a lot of awareness into different spaces that we can start thinking. So I'm very grateful for this learning today from our panelists. So across the discussion, one central idea that's emerged is digital resilience is no longer optional. It's really essential. In this world where young people are constantly navigating misinformation, algorithmic influence, cyberbullying, AI, shifting identities online, we must realize that their ability to thrive digitally has to be deeply embedded in the structures or where they're engaging. It's deeply tied to mental health, safety, development, and the ability to thrive. So from our panelists, we've heard several insights. We began with a shared understanding of what digital resilience means, and really, it doesn't just mean one thing. It's really this capacity. I think it's less of a noun, it's more of a verb, about the capacity of young people to adapt, to recover, to grow in the face of digital adversity. And Alicia reminded us that identity really plays a critical role here, and how youth see themselves and how they see themselves online can shape a sense of identity and belonging in digital spaces. And there are many different types of digital spaces, and we need to really have an understanding of where are young people today, and how do we shape these digital spaces to be safe spaces for young people to thrive, get information, connect to services, but also know where the real playgrounds are in their community, and the people are in the community where they can get that extra 3% on their grade to actually do things in person. Eva, you painted a sharp picture of today's threats for young people, both as a mom and as an academic, and I share that, and basically the scale and speed of misinformation, and we need to be prepared for that in the research world, and it's not the first time, and I think COVID actually paved the way of how we can have much more responsive research in this space with technology as it's getting faster every day. Sarah, I really appreciated learning from you. I did say, Naz, what is this lady doing on our panel? She does dementia research. But just absolutely brilliant perspective that you brought about developmental lens to our conversation, and prioritizing co-design and showing us the ability to bring different communities and generations together to co-design solutions so that we can understand how children mature emotionally, cognitively, socially, and how we can develop developmentally tailored systems that can be flexible, that can be centered on the needs of community, and can be really forward-thinking in institutions like UBC, where we can be really at the forefront of this instead of constantly responding. I think collectively, you all talked about how young people are not passive consumers. They are the experts, and they need to be in the room. And so I was thinking while you were talking, like, how do we hire a 12-year-old to co-design the solution to this post-secondary education strategy? We have to actually hire the 12-year-olds. They know what's going on right now, and they need to help us through the generational growth of this. And so hiring middle-aged researchers right now might not be the best idea. We need to figure out structures that bring in young people and their voices. And then transitioning into higher education, Sarah, you noted how digital stressors and also all of you actually talked about this, how they just compound. There's academic integrity challenges, there's digital overload, there's blurred boundaries. Eva, you talked about that between online and offline life. And I think institutions like UBC have a role. We have a big role, but often we're reactive instead of proactive. And so how do we start to think about what the collective way is that we take all this siloed research and put it together so that we're proactively ready for what the next thing is, and responsive to the needs of young people. So looking into policy and institutional change, we explored how campuses can create safe digital environments, not alone, but in collaboration, potentially with tech platforms and governments. And we really need this effective policy work to happen so that it can be intersectional, evidence-based, and inclusive. And then we talked about equity as well, and I think this was a theme that was really important, and I wish we could dive even deeper into this, but digital resilience cannot be built on systems that continue to exclude people. We have to figure out how we represent those who are equity-deserving groups and who are at the table as well. And I'm going to bring Al back into the room since they weren't able to join us on the panel, but one of our pre-calls leading up to this, Al really just reminded us that research can't sit in journals or policy memos. It must be embedded in support systems, curriculum, education training, and where young people are at. We have to wrap technology around the problem, not the problem around technology. And that's where we can truly transform. And then back to Dr. Bacon's comments, or President's comments, we need to be able to create an environment, one that is hyper-connected but isolating. We need to find a way to foster hope. And I think if we are organized, we are collaborative, and we put youth voice at the forefront, we have a really good future ahead of us. So thank you for coming. Thank you for participating online. And mostly thank you for our panelists today for contributing your expertise and modeling how very diverse portfolios and expertise can come together with the shared vision of health and wellness for all young people. Thank you.
Thank you.
Thank you, Sky, and